Welcome to Adapting Plus. If you are studying antibiotic for the NCLEX or nursing school, stop scrolling. These 15 questions, it covers the most testable antibiotic class you're supposed to know, and we're going to present it in using the critical thinking format, case format, to be able to understand how to take care of your patient using these antibiotics. We practice question, high yield fact, critical thinking, test taking strategy, what you need to know for your NCLEX. Stick around. Let me make it easy for you. These are the list. First question, as you can see, a nurse is caring for a client who has a severe infection and is prescribed what? Penicillin. This is the warm-up. The client report itching and rash. What is the word? Nurse priority action. Keyword in the question, penicillin. What do you know about penicillin? It's an antibiotic. You just have to identify it. First thing, what are they asking you? Client has complained. What is the complaint? Itchy and rash. What do you think? Something is not right with the patient. Test taking strategy, critical thinking. You have to intervene. If you don't need to intervene, still, you got to figure out what is the problem. One said, give the patient diphenhydramine and continue the medication. Two said, stop the penicillin and let the doctor know. Three said, reassure the patient, right, that itching is normal. Don't worry about it. Monitor for any signs of improvement. Number four is what? You don't do anything. So take it out. Then one and two and three, think about it. Use your critical thinking. Use your test-taking strategy. Use yourself as a nurse. If you are in this situation, at least you got to do something. Do you give a diphenhydramine? Or you stop the thing and tell the doctor? Or reassure the client that this is not a problem. Penicillin, antibiotic, rash, and itchiness are never normal. Therefore, what do? Stop the penicillin and let the doctor know. Number two is your right answer. This is the hard one. There's 3-4 hard ones before then I cool you down. This is the way the test is designed. A nurse is reviewing the medication list of a client being treated for what? UTI. The client ECG is shown below. You have to read the EKG. Which prescription should the nurse suspect? Is what? Test taking strategy, critical thinking, pharmacology, using NCLEX questions and answers. So critical thinking, what do you think is the problem? Patient has UTI, being treated with some form of antibiotic. I have no clue. But then they say EKG changes. That means the concept being asked, one of these medications causes hyperkalemia, hyponatremia, hypocalcemia, some form of EKG, QT prolongation. I have no clue. But if you look at the EKG, stop the video, try to answer it, and you can see that these are peak T waves. Therefore, I have hyperkalemia. Which of these causes hyperkalemia? You have to know the drug list. What is levofloxacin, doxycycline, vancomycin, and trimethoprim-sulfamethoxazole? All of them have specific side effects. And by the end of this video, you will master them. Levofloxacin does not do that. Doxycycline does not do that. I cannot give you the key fact about them because there's questions that will be used to answer that. The more we get it, we learn about that. Vancomycin does not do that. Sulfur drugs are very common. Number one, causes hyperkalemia, and therefore, this is hyperkalemia. Peak T wave, that's the cause of it. Critical thinking question, pharmacology using NCLEX questions and answers, and you're practicing using your knowledge test-taking strategy. Which of the following medication or dietary item in the client's record will require the nurse to intervene? Same thing. I had one designed to teach you that you can use critical thinking, case study, idea, and using what you know, concept to answer this question. And nurse care for a client prescribed what? Linezolid for what? Resistant bacteria. What do? Stop the video. This is the way I approach it. I see selected apply. I'm going to pick something. I'm confident. Then I said, what is it? They said dietary and what? Medication. I can see dietary and medication. What is the patient is on? Linezolid. I need to identify what linezolid is. And it's used for bacteria. But what is the problem? Patient is taking these antibiotics Should they take any of this? Tramadol, pseudoephedrine, sumatriptan, smoked ham and rice, or salami and pepperoni? Test taking strategy using your content. This is a practice test. I'm giving you the content associated with these antibiotics. Linezolid is one of those medications you can take by mouth. It does the same thing as vancomycin. But what is class about them? They are very, very dangerous. They have MAOI-like. That means they can act like one of the antidepressants. So they can increase your monoamine levels, MOIs, like monoamines, which are serotonin, dopamine, right? Norepinephrine, all these things, you should avoid anything that will increase that. Tramadol is a serotonin stimulant. It acts on serotonin receptors. You should not take it with linezolid. Pseudoephedrine will increase your pressure. And since linezolid is going to increase your monoamine, it's also going to do the same thing. Sumatriptan is a serotonin agonist. You should not take it with linezolid because it's going to increase your serotonin. Smoked ham, which has high level of what? Tyramine, you should not take it when you're on linezolid. Salami and pepperoni also has a bunch of tyramine product. Therefore, you should not take it. Therefore, all these answers are right. Once again, keyword is linezolid. You should avoid MOI-like food, which are tyramine, and you should not take anything that has serotonin in it. The next question is what is answering that question. And next care for a client prescribed what? Linezolid, and recently prescribed what? Tramadol. I told you about those combinations. They shouldn't happen. 4 hours later, the client is tachycardic and diaphoretic. Which additional findings should the nurse expect? Select or apply. Think about it. Linezolid is a serotonin agonist. Tramadol is a serotonin agonist. That means you have two serotonin chemicals in your system. You're going to increase your serotonin. 4 hours later, the patient has what? Tachycardia, diaphoretic. What do you think? Look at the answers. Which additional findings should the nurse expect? Aporeflexia, clunus, hypothermia, calm demeanor, constricted pupil, respiratory rate of 10, and muscle rigidity. Content. Tachycardia, diaphoretic, taking two serotonin agent. Stop the video. Something should ring in your ear and say, hey, this is what? Serotonin syndrome. The patient has serotonin syndrome. What should I expect in serotonin syndrome? I don't memorize this. This is the trick. This is the memory trick you should take with you. Serotonin syndrome. Don't memorize the symptoms. The buzzword is what? Everything is going to go up. The buzzword is everything goes up. Look at the answer choice. If you see things going up, you pick it. Aporeflexia, I'm not going up. Clunus, I'm going up. Hypothermia, I'm not going up. Calm demeanor, I'm not going up. Constricted pupil, I'm not going up. Respiratory rate of 10, I'm not going up. Muscle rigidity, I'm going up. Therefore, there's only two answers there, 2 and 7. Somebody will say, well, respiratory rate is low, constricted pupil is associated with what? Tramadol. But that is not the scenario. It's taking linezolid plus tramadol. It's called serotonin syndrome. This is not opiate overdose. Two answers are there, clunus and respiratory and muscle rigidity. 2 and 7 are your right answer. What is the best next consideration? A client is prescribed ceftriaxone for what? Bacterial pneumonia. The client has a history of anaphylaxis to penicillin. Straightforward concept for you to grab. You take penicillin, you are allergic to penicillin, and I'm giving you ceftriaxone. The concept is there is a cross-reactivity. Which answer choice you think meets that criteria? Put down in the comment. Cross-reactivity. Administer ceftriaxone as prescribed. Do you think is right? Administer a test dose and observe allergic reaction. That is a bad choice. Hold the medication and consult the healthcare provider before administering properly. That's the good one. Pre-treat with steroid to prevent allergic reaction. Don't do that. Which one is the right answer? Let the doctor know. Hold the medication. There's a cross-reactivity over 50%. You should talk to the doctor. And this is teaching a client prescribe erythromycin, right? Erythromycin about possible side effect. Which statement by the client indicate understanding? I might experience hearing loss and ringing in the ear. I will avoid dairy products while taking the medication. I should expect increased urination. I can take this medication with antacid to reduce stomach. Stop the video, put down your answer, put in the comments. Let me know what you think. But this concept is something I'm giving to you so that you can know when you see a question, be able to answer it. Erythromycin, when you see it, tell yourself what kind of drug it is. This is what? Macrolide. What are the things you need to know about macrolide? They cause QT prolongation, and the other thing is ototoxicity. Do you see ototoxicity there or QT prolongation? Number one, talking about your ear. I'm picking that answer. I don't know anything about avoiding dairy products. I don't know about increasing urination. I don't care, antacid. But my concept, two things I'm taking with me today, every time I see a macrolide, QT prolongation, and ototoxicity. The pregnant client is prescribed what? Doxycycline for severe acne outbreak. What is the next best action? Which medication? This medication is safe during response. What is the next best response? This medication is safe during pregnancy. You should avoid this medication. Make sure to take this medication with milk. You can take this medication anytime, even before bedtime. Look at it. Bunch of answers. There's some that are contradicting each other. One said the medication is safe during pregnancy, okay? The two said you should avoid this medication. Both cannot be right. Both cannot be right. Make sure to take this medication with milk. Well, one and saying that 1 and 3 is saying the same thing. Then one says safe, one says I should take it with milk. You can take this medication anytime, even before bedtime. So 1 and 3 and 4, I say take it. And 2 said don't. That should be a red flag. Even if you don't know doxycycline causes something, test-taking strategy, critical thinking with these pharmacology questions is clinical. 3 answer choices say I should do something, and 1 say I shouldn't. The odd one may be the right answer. It's not safe. It's not safe. This tetracycline, you cannot take it with milk, no antacid. It can cause either teratogenic, it affect bone and teeth development, and therefore you should avoid this medication. Number 2, the client receiving IV gentamicin develop tendinitis and dizziness. What should the nurse prioritize? You get the antibiotic, you have side effect. Always be safe. That's all. Be safe. The answers are not esoteric. Be safe. Something, I got to do something. At least let the doctor know or stop the medication to figure out why the kid or the patient having dizziness and tendinitis. This is how you answer question. You don't make it difficult. Slow down the infusion. Something say I should slow it down. 1 said I should notify the 2 said I notify the healthcare provider. 3 said, well, give them antibiotics, right? Because they have nausea or something. That's why they have dizziness. Encourage the client to drink more fluid. Which one is safe? Tell me. Which one is safe? Put it down in the comment section. What do you think? Which one is safe? You slow down the infusion, it's still going. Notify the healthcare provider, most likely something bad is happening. And before you notify them, you most likely will stop the medication. I did not put there stop it because I want you to think. Notifying the healthcare provider, at least somebody else knows about it. If you slow down, that means the whole thing is ignored. So 2 is better than 1. 2 is your right answer. Which assessment the nurse should practice? The nurse is caring for a client with what? Ciprofloxacin, right? Ciprofloxacin are fluoroquinolones. They have specific side effects. What will you prioritize? Respiratory rate, Achilles tendon, tooth for what? Discoloration and low WBC. Well, if you're taking ciprofloxacin, I can check your WBC. It's going to be low. But is there a prioritization? No, I don't care about it. That means there's a content you need to know about ciprofloxacin. What do you think? Respiratory rate. Okay, I know a lot of people will pick it because it's talking about your airway. But the question has nothing to say. It doesn't say anything about respiratory, some patient shortness of breath or anything like that. This is a concept level. You see that, and they did not give you anything. That means they want you to pick something specific for that medication. If I want you to pick about respiratory rate, I will give you a scenario. When you see question that has nothing in it, it has the name of the medication, which you prioritize, that means something specific about that medication. This fluoroquinolone causes tendon problem. You can have tendon rupture, they have tendinitis, therefore we should check what? Achilles tendon. Discoloration is not, mostly tetracyclines are the one that do that on your teeth. The client is taking trimethoprim-sulfamethoxazole, develop a rash and fever. What is the priority next action? Request for antihistamine, notify the HECA immediately, assess hydration status and increase fluid intake, monitor the liver function test. I have something about prioritization. I call it, you have to be sharp. What do you mean? You talk about breathing issue, electrolyte, shock, sepsis, airway, and pain. That means you have 1 second. There's things about a patient that is constant. Some that you have just 1 minute. If you don't do it 1 second, patient die. These suffer drug, they are dangerous. Photosensitivity and Stevens-Johnson syndrome. I see a rash and fever, that's sepsis. Be sharp. What do? Give the antihistamine to take care of fever and rash that you know is sepsis. Let them drink a lot of water. Of course, yes, sulfur drug causes kidney stone, but this is not kidney stone. Monitor liver function test, but this is not liver problem. I'm going to have joined this with liver problem. You should notify the healthcare provider. This is Stevens-Johnson syndrome. Which client statement indicate the need for further teaching? And then teaches a client prescribe what? Metronidazole for bacterial vaginosis. You have infection, we give them metronidazole. What teaching provided? They never told us, but which one need further teaching? I will avoid alcohol during and for 24 hours after therapy. Okay, I can take this medication with food to reduce nausea. Okay, I will use mouthwash to prevent tooth discoloration. Okay, I should finish all the medication even if I feel better. Okay. If you're watching this video and you're here, thank you very much. And thank you for following Adapt NCLEX, and thank you for following the series. Put down in your comment, what do you think before you listen to me? Let me know what you say about, or what you pick, the first thing that came to your mind after you read the answer choice. Let me know what you think. And this is a concept that you have to take with you. Metronidazole, look at number 1. One said avoid alcohol. That means alcohol is bad. You can't take alcohol with you. But they forget that 3 is also alcohol. Mouthwash has a bunch of alcohol in it. If you use a bunch of mouthwash and you go and do a breathalyzer, police will catch you. You're going to test positive. Your alcohol level will go high. Therefore, number 3 is the right answer. They forget. This is one of the teaching you provide to the patient that if you take metronidazole, there is some eating areas in our body, in our life, that contain alcohol, cologne, vinegar, whatever, and sanitizer. Stay away from it. So give them a list of things that alcohol is hidden so that they don't get sick. The client is receiving vancomycin via IV, develop flushing and itching on the face and the neck during infusion. What should the nurse do first? This is red man syndrome. What is the treatment? Red man syndrome. It's not allergic reaction. If I see allergy stuff there, I'm not picking it. Once I stop the infusion immediately, it's an allergic reaction? No, it's not allergic reaction. It's what? Infusion-induced flushing. So if you slow it down, it's usually help, right? Unless the patient is having wheezing, hypotension, you can stop it. Administer epinephrine. It's not an allergy. Continue infusion and monitor vitals. You have to do something. Therefore, slow down the infusion. Client on Linezolid therapy reported headache and elevated blood pressure. We've seen Linezolid, right? MOI-like symptoms that will cause hypertensive urgency. What is the next best action, right? MOI, right? You know that's why the blood pressure is high. Do you see anything that say anything about MOI? You see how I answer the question. I go for the content, and I know what I'm looking for. When I'm looking at the answers, I'm looking for the content associated with what I'm looking for. Encourage increased fluid intake and rest. It doesn't say anything about MOI like. Inquire about last meal. Oh, did they eat any tyramine food? Administer acetaminophen for headache relief. Okay, I'm treating the problem, but I have to find out why they have hypertension. Continuing therapy as symptoms are mild. It's not mild. Therefore, find out if they eat any pepperoni or cheese or cheese or anything like that. Number 2 is your answer. And this is caring for a client receiving amoxicillin. They develop diarrhea, right? What would you do? What advice would you give the patient? This is common side effect. Drink a lot of water. Stop the medication immediately to avoid complication. Take over-the-counter medication such as antiviral diarrhea so that you don't have more diarrhea. Avoid eating fiber-rich food while on this medication. Well, think about it. You have diarrhea. You take antibiotic. What is the most common side effect of antibiotic? Diarrhea, because it changed the flora, the oral, the GI tract, the bacteria. Good bacteria get killed, and therefore you have diarrhea. So it's okay to tell the patient it's common side effect to drink a lot of water because of the diarrhea. But stopping the medication is wrong. Taking anti-diarrhea, that means you're taking Imodium for something that is expected finding. Avoiding fiber-rich will decrease your diarrhea. So it's good to bulk your stool. We're going to pick what? Number 1. And the last one. I know you got this. How many did you get? I know you get 15 out of 15 because you watch Adapting and you know the strategy to answer the question. Thank you to getting to the end. Client is prescribed ciprofloxacin and asks about sun exposure. They are photosensitive. Stay away from the sun. What should the nurse teach? You can't be outside without sunscreen. Always a bad thing. Wear a hat and long sleeve for outdoor. Probably is good. Sunlight will help the medication work better. No, they are photosensitive. Wear protective clothing only if you plan to be outside for 8 hours. No, every time you go outside, wear protective clothing and have a sunscreen. You know the answer. You pick it, and I know you got it. Number 2 is the right answer. Thank you for following the series. Pharmacology, NCLEX practice questions and answers, practice test number 7. Antibiotics, the top antibiotics that we can have. 10 of them. You got it. There's no questions that will beat you. You have a good day.